Dr. Barnes here. Welcome to the bonus antipsychotic lecture. This is your present for sitting through the other three lectures. So here we go. I thought it'd be fun to kind of go through every one of these medications, or at least most of them, kind of give you my opinion and quick pointers on each one. So here we go. First generations are not really standard of care, even though you'll see Haldol in every emergency room in America, basically. We should be replacing them with the atypicals. These tend to be a little bit of a better side effect profile in the long term also. But Haldol is a good medication to be used in an acute setting in an emergency room. Comes in IV, comes in IM, comes in oral, comes in liquid, comes in all types of forms. Another interesting thing, Thorazine, chlorpromazine, was the first antipsychotic ever made, like in the 1940s, 50s, something like that. And before that, we were doing not so good things to treat psychiatric people. We didn't have anything to treat them. In came a medication, chlorpromazine, which was groundbreaking for schizophrenia. We then learned that it came with some of the baggage that we mentioned before, but still was a kind of a medicine that started it all. Then there's Prolixin, Trilify, Mellaril, not much to say there. The first atypical it made was risperidone. They actually took haloperidol, slightly changed it, made risperidone. That's why risperidone is a DONE medicine that is a strong D2 blocker. This is real interesting to me. When you take risperidone and it goes through the liver, it actually turns into paliperidone in Invega. And Invega comes in a long-acting injection called Invega Sustenna, which is a good medication. And this may be a cleaner version of risperidone, and risperidone may be a cleaner version of Haldol. Moving on, Geodon, Ziprasidone, very good medication. This was the first weight-neutral atypical antipsychotic that was made, probably, that made us realize, wow, there is a way to maybe create an atypical that has less weight problems. So this is a good choice in somebody that wants to use their insurance and get an atypical that's covered. Fanapt is a new one also that has a little bit less weight gain. Most common side effects maybe dizziness, things like that, but really good, got an approval for bipolar maintenance and other phases of bipolar as well. Latuda was one of the early ones in the atypical world that got a bipolar depression indication and is also more weight neutral and may be more safe in pregnancy in comparison to the other ones. Clozapine also has some data in pregnancy. Interestingly enough, clozapine is the only one out of all of these that's shown to be better than the other ones. And this is the one that is reserved in refractory schizophrenia, or people that didn't respond to multiple medications, but it does come with a risk of agranulocytosis that has a whole protocol on how to overcome. Ceracolcatiapine is a fan favorite among many folks because it helps with sleep, mood, anxiety, bipolar, depression, you name it, schizophrenia. It treats a lot of things, very versatile medication. Then there's Abilify, aripiprazole. These are the partial dopamine agonists, if you remember. Rexulti, brexpiprazole, which is maybe a cleaner version of Abilify. And then Vraylar, another partial dopamine agonist, which is very good, approved for bipolar depression and as an adjunct in major depressive disorder and other things. Also maybe a little bit more weight neutral. And for the people that mentioned that I didn't bring it up, Caplyta. Here we go. Also called lumateperone. This is an interesting one. This is the newest medication that I got an indication for bipolar depression. I'm running out of time, so I don't have that much time, but this also has less weight gain in comparison to some of the other ones. Most common side effect was dry mouth, which is different than what you would hear with some of these other ones. And long story short, for bipolar depression, I do like this medication. Hope you guys enjoyed.